Welcome to Medicare for All Explained. This podcast will enlighten our listeners and dispel the distortions that surround Medicare for All. Medicare for All Explained is produced in collaboration with Physicians for a National Health Program and is hosted and produced by Joe Sparks. I'm your host, Joe Sparks. This is episode 86, Medicare, a Complicated Mess. In this episode, I will discuss that Medicare is more complicated than it needs to be. I received the official government handbook for Medicare last week. It is titled Medicare and You, 2023, and it is over 120 pages. Now, I think that most people are not going to read 120 pages, but if they do, the handbook leaves out some critical information, which I will discuss later. I want to emphasize one point. I strongly advise that you go get an original Medicare with Medigap plan. I will explain why, but first I need to discuss the differences between original Medicare and Medicare Advantage, or the more fitting name, Medicare Disadvantage. Note, I am not giving every detail about Medicare, and I may simplify some of the details. If you want all the details, I will supply a link to the Medicare handbook in the description for the podcast. There are 4 parts to Medicare. Part A, which is hospital insurance. This covers inpatient hospital care, skilled nursing facility care, hospice care, and home health care. Part B, which is medical insurance. This covers doctors and other medical providers' services, outpatient care, home health care, durable medical equipment, and preventive services. Then there is Part D, which is drug coverage. And these parts A, B, and D are considered to be original Medicare. Then there is Part D, which is drug coverage. And these parts A, B, and D are considered to be original Medicare. Finally, there is Medicare Advantage, which is also known as Part C, as in Charlie. In original Medicare, you pay premiums and the government pays for your care. Original Medicare contracts with physicians, other medical providers, and hospitals to provide services at set rates. You can also arrange to get Medicare supplement insurance or Medigap insurance to reduce the amount of out-of-pocket costs. In Medicare Advantage, you pay premiums and the government contracts with insurance companies to pay for your care. Medicare Advantage plans have all the disadvantages of private insurance: out-of-pocket costs, limited networks, and denial of care. The Medicare handbook leaves out some important points about Medicare Advantage plans, or does not emphasize or explain the significance of certain rules. One point that is not emphasized or explained well is that when you sign up for Advantage plans, you may not be able to get a Medigap plan if you want to go back to original Medicare. This point is not raised until page 64 of the handbook. After you have been in an Advantage plan for 12 months, Medigap plans can require underwriting before letting you into the plans. The Medigap insurance company can then charge much higher premiums or reject you depending on the underwriting results. This is significant because some patients in poor health want to leave their Advantage plans, but discover they can't get or can't afford Medigap plans. So they are stuck with inadequate insurance and expensive out-of-pocket healthcare costs. The handbook also neglects to mention that some Advantage plans engage in fraud. This fraud manifests itself in 2 known ways. One way is denial of care, which is a problem in many and possibly all private health insurance plans. The second is upcoding. This is when insurance companies list medical problems for a patient that are not treated. For Advantage plans, Medicare pays a set amount to the companies for each patient's medical problems, whether they are treated or not. This causes companies to list any potential health problems, even if they are not serious and don't need treatment, in an effort to get more money from the government. This causes companies to list any potential health problems, even if they are not serious and don't need treatment, in an effort to get more money from the government. As an aside, I don't know why the government does not prosecute the upcoding and the denial of care fraud and force the companies to stop selling Advantage plans. This fraud will continue until the government takes action. I will supply links in the description of this podcast that describe some of the problems with Medicare Advantage plans. So now, let's discuss what makes original Medicare complicated. You can qualify for Medicare if you are disabled, have end-stage renal disease, or a few other ways. I am not discussing those qualifications. The most common way that people qualify for Medicare is working 40 quarters or 10 years and paying the FICA taxes for Social Security and Medicare. You needed to earn $1,470 per quarter or $5,880 per year. If you meet these requirements, you are automatically enrolled in Medicare Part A, and there are no premiums for Part A. But Part A does have deductibles and coinsurance. As previously mentioned, Part B covers doctor visits and some other services. The monthly premium for these services is $170.10. Part B also has deductibles and coinsurance. One of the problems with Medicare is that there is no limit to the out-of-pocket cost. After you pay your deductibles, Medicare requires that you pay coinsurance for 20% of your medical costs. Medicare supplemental insurance, or Medigap plans, can be used to control costs. New enrollees to Medicare can choose from 8 Medigap plans: A, B, D, G, K, L, M, and N. Each plan has a different level of deductible and coinsurance requirements. I am not going to discuss each individual plan, but there is an important point to remember. All plans within a category have the same benefits, so you want to pick the cheapest plan within that category. Plan G provides the highest level of benefit, and the only extra out-of-pocket cost with Plan G is the Medicare Part B deductible of $233. I recommend Medicare with the Medigap Plan G, and that is what I have. When I first looked at the premium for Plan G in my state, they range from about $136 to more than $300. Naturally, I picked the plan that cost $136. The downside to Medigap plans is that there is another premium charge. Now, since Plan G has the best benefit, it also usually has the highest premiums. Another Medigap plan would most likely have lower premiums, but would also have higher out-of-pocket costs if you need medical care. The other benefit of original Medicare with a Medigap plan is that I can go to any hospital or doctor in the country that accepts Medicare. Original Medicare provides a nearly unlimited network of doctors and hospitals. There are two important problems with original Medicare. It does not cover vision, dental, or hearing, and you must purchase a separate Part D, as in Delta, for drug coverage. And of course, this requires paying another premium. This brings us to Medicare Advantage. As I mentioned previously, Medicare Advantage has problems. Some Advantage plans deny care and upcode, which are forms of fraud. Also, like most private insurance, Advantage plans have restricted networks, and doctors and other medical providers can leave or be dropped from a plan's network at any time. Patients in poor health sometimes decide that they want to leave their Advantage plans. So why, with these problems, would anyone choose a Medicare Advantage plan? Well, if you don't get sick, Medicare Advantage plans can be cheaper. Some Advantage plans only require that you pay the Part B premium, and sometimes the plans also include a drug plan and some vision, dental, and hearing benefits with no extra premium. For people on tight budgets, this can lower costs as long as they don't get sick. If they get sick, they may end up paying more in a year than if they were on original Medicare with a Medigap plan. Most Advantage plans do limit your maximum out-of-pocket costs, but this limit can be several $1,000s or tens of thousands of dollars. The other thing that is infuriating is that the government provides an unfair edge to Advantage plans by allowing them to provide benefits for vision, dental, and hearing. Original Medicare is not allowed to provide these benefits. All these options make Medicare a complicated mess. You have many parts to Medicare, and a person needs to figure out whether to get a Medigap plan or use Medicare Advantage. This can take hours to determine. In fact, it did take me hours to figure out the best option for me, and that was original Medicare with a Medigap Plan G. We could and should end this complicated Medicare mess with single-payer Medicare for all. Instead of a 120-page Medicare handbook, only a few pages would be needed explaining how you enroll in Medicare for all. There would be no restrictive networks, and everything would be covered with no out-of-pocket costs. Seniors and everyone else would have better and more comprehensive coverage. Thank you for listening. You have been listening to Medicare for All Explained. Remember to tell your family, friends, and colleagues about this podcast. Information about Medicare for All Explained can be found at our website, medicareforallexplained.org. The music for this show is Super Bubbly by Jesse Spillane. The logo was created by Lily Sparks. Thank you for listening.